basically the suctioning part is all same, but the catheter and the ventilation and all that's a little different. Okay? So if you're about to suction a trach patient, and how do you hyperoxygenate the patient? How to breathe? Bags with bags.
Do they have spontaneous respirations at all?
Okay, just want to clear up with them first. He said non-breather. I mean, how can you put a non-breather?
Put the ventilator on 100%.
Yeah, I mean, if the patient is on the ventilator, you can push the 100% button on the ventilator. Have you ever seen any of you seen that yet? I know all the students with me saw that.
Well, I might answer this wrong because if it was my daughter and if she wasn't on the ventilator, there's like a little ring piece that goes over her little nose that you can take oxygen to, and I would give her it through that.
When you say nose.
You don't, you know.
I know, but they don't understand.
A little HME.
Oh, the artificial nose?
Yeah.
Okay. The
You know what I mean?
artificial
But
nose,
so you don't
that-
talk the green tube, but you know what I'm
Right,
talking about.
right. When she talked about artificial nose, that goes on the trach. Okay. All right. So if they are not on the ventilator, you could either ambu the patient with the 100%, take the patient off, whatever, and bag the patient.
That's why I get mad and she cried and she let it go away. Get that off of me.
Hyperoxygenate that way. Or
How many?
about a minute or so, 1 to 2 minutes. And if the patient is not on ventilator, then if they are on trach collar, how do you hyperoxygenate?
You can just do it.
Well, a couple things you can do. You can hyperoxygenate by taking the patient's FiO2 from whatever, like if they're on 40, take it up to 100%. That doesn't mean that you're going to hyperventilate. You're going to hyperoxygenate them, but you're not going to ventilate them. So if you see a patient that's shallow breathing, and if you really want to hyperoxygenate and hyperventilate them, you really have to take them off and bag the patient. But if they're already breathing nice and smooth and normal, then you can just turn up the FiO2 on the bottom to hyperoxygenate them. Y'all getting what I'm saying? So not all the patients are good enough. You can just go over there and turn the FiO2 up to 100% and start suctioning the patient. It's not a good idea. But look at the patient. If they are on, if their pulse ox is normal, reading, normal levels, and they're breathing like normal. And if you want to hyperoxygenate them, just go ahead and turn the dial on the aerosol bottle up to 100%.
So even if they're reading like, 98, 99% pulse ox, you can still bump up, give them a little bit more.
If they are not breathing deep, if they're not taking nice deep breaths, yeah, you take them off and back.
If they're on room air, when you come into the room and you're gonna suction them.
Absolutely, you have to hyperoxygenate.
Okay.
His question is interesting. He's saying 98, 99 sat level. He's still, and I would think, yes, if you want to put too much oxygen
Yes,
into the blood.
you need to give them more oxygen.
Okay.
And
You're going to take away below the 98.
right. The question is not only hyperoxygenate them, do you want to hyperventilate them? Okay. Yeah. I mean, you do want to hyperoxygenate and hyperventilate the patient. Well, you cannot hyperventilate with somebody with a trach collar. What you can do is you can ask them to take deep breaths while you turning the dial up to 98%. And if they can do that, yeah, you don't need a bag. You turn the dial up to 98% on the bottle. Okay? But if they can't take a deep breath, you have to take them off the trach collar and bag them with the 100%.
If they take a deep breath and you're going in there to suction, and they probably got a bunch of crap in there, and they may induce a cough, and a big loogie might come flying out.
So either way, if they can't take a deep breath, then you do that.
Yes.
Okay.
That's what we do. We don't actually go in there and bag everybody when they suction. If they're on trach collar. We ask them, can you take deep breaths? They'll say, okay. Then we just turn that FiO2 up to 98% and ask them to take deep breaths for about a minute or so. Then go suction.
If they're on a ventilator, then
Yeah, if they're on the
you
ventilator,
just turn the oxygen
yeah, you push the 100% button on the
Right.
ventilator.
and then suction.
Then use the inline suction to suction.
Okay.
But if you're taking them off the ventilator to suction them, bag them.
Bag them.
If you're taking somebody off the ventilator, that's definite. What happens if they're on the ventilator and you push the 100% button and you're taking them off?
They're not getting that 100%.
Yeah,
Yeah.
they're not ventilated. They need to be ventilated. Okay, so.
So that would be if you did, they would most likely not have inline suctioning,
Correct.
probably.
The first one I'm going to show you is, just imagine this patient does not have an inline suction catheter. This patient is on a ventilator at this point with trach. No inline suction catheter in place. Okay, for some reason. The doctor didn't want an inline. So, but they want you to suction the patient. My first question is, how do you hyperoxygenate this patient?
And you said they're, say, I didn't give a scenario.
We
Don't
still
this
write it.
patient-
100%.
Say it again.
This patient does not have an inline suction catheter,
Okay,
but he is on a ventilator.
okay.
And you want to take him off the ventilator and suction him with a regular suction catheter.
Okay, you're gonna take
How do
him
you
off
hyperoxygenate?
and you're gonna use the ambu bag.
Correct. You're going to take him off.
Because as soon as you take them off the vent, you're gonna lose the 100% you put.
That's right.
Yes.
That's right. So therefore, pushing 100% on the ventilator is not going to do anything because you're going to take him off to suction patient. Okay, that's what I'm going to do right now. We do this sometimes. If they have thick mucus, for some reason the ballot does not work, the ballot doesn't work with every patient. Sometimes if they have thick secretions, we would prefer them to come off and we will ambu them and suction with the regular catheter. Okay, to break that stuff. Okay, that's what I'm going to do first. Okay. So, you silence the ventilator, you're taking him off the ventilator and ambu it. Before that, you have to get this thing ready. This step is pretty same that we showed you last week. How do you put the gloves on? This is not going to go on my hand. This is
The septic technique.
okay. You don't want to touch outside. It's very small.
Just pretend that one of these other ones.
Well, I got it. So I got this one on and it's sterile. Now I can touch this glove anywhere I want now. But I have to slip my hands inside. You see this? Slide it up. Out of the way. All right. Now, take this. On it. Thanks. Now, this is where the important question comes in. What size of suction catheter should I use for that trach patient?
Oh, we went over this last night. Okay, you take the size of the tray and you
The
divide.
size of the trach
tray
is, let's pretend this is 4. Okay.
And
This
you,
this trach is number 8.
so we said last night, we divide it, divide it by
No, what, half
2,
of, half of
take
it,
half the size.
and then multiply
Before
by
we
3.
say anything, I want you to look into the lab.
The lab book, I don't have it with me, it's at my desk.
Catheter numbers go
She
higher.
has it. Brian, you
Alright,
have
look
it.
it up.
It's there. I looked at it this morning before we
Catheter
came.
numbers go higher as it gets smaller.
14?
Uh,
Would it be 14?
Divide by 2, multiply